There are many different conditions that can cause medial knee pain. Some of the more chronic conditions are osteoarthritis of the joint or degeneration of the joint and meniscus tears. Some more acute types of injuries are MCL sprains, subluxating kneecaps or patellas, and pezanserine bursitis. So now I'm going to show you a few exercises that I use in the clinic to help alleviate your medial knee pain. The first one is a straight leg raise. This really focuses on the quadricep muscle and supports the joint itself. So what you can do is making sure that you really are pushing your quad, turning it on before you do it, and you're gonna lift that leg up. Now you can also do this laying down, and we'll show you that as well. If this is too easy, you can always add an ankle weight, and that way you can start to progress your exercise. The next exercise we're going to do is the seated knee extension. So off of a chair or couch, basically you're going to make sure that you're engaging your quadriceps and bringing that leg up, and you'll feel that quad kick in to make sure you know you're doing it right. Now, to advance this exercise, you can either use a TheraBand and attach it to the leg of a table or a leg of the couch, or you can put an ankle weight on to make it a little bit harder. Another really great exercise I use for medial knee pain is the medial ball squeeze. So what I do is my knees are going to be bent, feet flat on the table or ground, and then I just put like a nice playground ball between my knees, and I'm going to squeeze it. So what this exercise is doing is really isolating your inside muscle of your quadricep to strengthen it. So I'm going to show you how to do it now. So we're just going to squeeze the ball, feeling all of the muscles and the inner thigh engage, and then relax it, but not enough to let the ball fall. So squeeze and relax. Squeeze and relax. So the exercises at the beginning are slightly easier. As we move along through this video, the exercises get progressively a little bit harder as they get more functional. So now I'm going to show you single leg balance, which helps to stabilize the muscles throughout the knee joint. What you're going to do, you're going to stand on a hard, firm surface and balance just on one leg. To make this exercise a little bit harder and to progress it, you can either stand on a squishy foam or an unsteady surface, or close your eyes. This next exercise, a resisted side step, is really great for working your glute medius, the part of your butt muscles. These really support your knee joint and help take the stress off of your knee. So you're going to keep your feet a little bit more than shoulder width apart. Keeping them that way. You're just going to side step 10 steps one direction and back the other direction. Like I said before, as we progress through this video, we're working on more functional strengthening. So this next one is a step up. So you're going to place that foot up on a stair or a stoop or a step, and you're going to step up and back down, really focusing on keeping that knee in line with your toes. So to make this exercise a little bit harder, you can either use a larger step or hold weights close to your body as you perform the exercise. But before you progress or advance your exercise, you want to make sure that you can really do it at the level in good form before you make it harder. So if you go to something harder and you're not being able to do it in the right way, then go back down to where you were before. So the last exercise I'm going to show you, and probably the most challenging of all the exercise I've shown you today, is the wall sit. So you want to make sure that you're kind of 90 degrees and your back is flat against the wall, making sure that your knees don't fall in. But this is a really great knee strengthening exercise and can really work these quads nicely. So to make this exercise just a tiny bit harder, you can put a weight into your arms and then do the same exercise as we were doing before. With all exercises, it's always important, if you're uncertain whether you should be performing the exercises or not, to consult a medical professional before beginning. These are great exercises to really address our medial knee pain and to strengthen the knee to help reduce pain and prevent it from happening again.